There are multiple challenges that we face dealing with the aging population in healthcare. The first is that statistically, 4 out of 5 Americans have a chronic condition, which means they have at least one chronic disease. That could be anywhere from asthma to heart failure to congestive heart failure to hypertension to obesity, just the high-level chronic care that everyone has to deal with, and the core things that a doctor checks every time you go for a general physician's checkup. So remote monitoring allows it to be monitored without me thinking about it, and that enables me to have better health care overall. InScope brings multiple areas of expertise to this mission area. We are always concerned of how to help the aging population. We believe it is a core value, a core right for every person to have the option to have the best of affordable and available care. In healthcare, we've had multiple results, multiple successes. Working with our partners, we're really working through grants and really identifying areas where we can see significant cost containment while improving the quality and aging of the patient. One case study overall shows that out of a 64-patient study, they saved well over $1 million 36 months after the study was completed. InScope's ability to scale and extrapolate that data and put it onto a broader plane and a broader user group just saves more and more every time you think of using remote monitoring as a solution. Challenges that we face really deal with finding a common ground, being able to get the payers to pay for the remote monitoring within the state's Medicare, Medicaid programs, having it set up so that way the policies are enabled to meet things like the Health Reform Act and other healthcare needs, using things like the Broadband Act to make sure that everyone has accessibility to a remote monitoring solution. So those are some of the core challenges that we face as InScope that we constantly are working on to deal with policy, to deal with other agencies and other companies that are providing the best solution integrated for the end customer and all the pieces and all the players that are involved in the healthcare field. This mission really looks at how do I help the state, Medicaid, how do I help the payee, the insurance company, to save dollars. We have to make it something that's usable for them because cost containment is of the utmost concern for the people who are paying for it. Secondly, we have to be able to make sure that we always keep in focus the practitioners. The practitioners are the ones who can deliver the health care that's needed. In the end of the day, we can make a system as integrated and as good as we need it to be, but our practitioners, the doctors, the nurses, those who are providing the true healthcare service need the tools in place that they can use to be the most successful at what they can do. Really being able to get the health care provided to as many patients as possible. I think the most important thing that InScope can provide is a broad-reaching solution, a solution that impacts person by person and then rolls it up into rural and urban communities. InScope International is constantly looking at ways that we can advance the global good of the health and wellness of the aging population. We definitely believe that it is a core right, a core value that everyone age with the grace and dignity that they deserve. In healthcare, of course, that requires us to take control and get the best care out to every patient available. We can do that through remote monitoring. We can do that through integrating that with their own healthcare record, and that alone will increase the global good and what the world is looking for as we continue to value and respect our aging population.